All right. So, John, it's the end of day 3 here of Root Camp 2 for the second time. And you've taken Root Camp 1, Root Camp 2 first time, Root Camp 2 second time. And in less than a couple of weeks, you're going to be embarking on a 12-month with me and 2 other mini residents for a year-long residency in Endo. So, I personally um, I like you very much as a person, but also as a clinician. I think you're very motivated. And from here, I just let you share yourself about your own motivation about endo and why you stick around and you want more and more and more. Please.
Um, yeah, I I've kind of always wanted to do endo, um, and I was looking for a good teacher. Dental school, they were pretty good, but they didn't spend a lot of time with me, so I didn't really like it too much. I did it 1 year GPR, had a had a really good teacher. It got me interested. It was kind of one-on-one for a year, 1 day a week with him, and he actually answered my questions, and I started working at endo, and then I've been about 25 more years of doing endo, and um, but I needed to learn some new technology and new techniques, and Dr. Wynn has taught me the latest cutting edge endodontics, and what impresses me about him is that he just doesn't do the easy ones. He does pretty much all of them, unless it's impossible. Um, he's not afraid to take on cases. He's got skill and knowledge, and pursues the best technology. And he takes me past where I'm comfortable, and he takes me to where I'm uncomfortable, and then teaches me something. And so, every time I come, I go. My eyes are opened. I've learned something that I didn't know before, and been very valuable. And and it's really great dentistry. The opportunity to come and learn better dentistry is something that every dentist should want to do.
Agreed.
Yeah, and so that's why I keep coming back.
Now, we were just walking back here and you said this opportunity isn't out there, you know, and
Yeah,
I agree, but
yeah.
please share with others why you say that.
Well, over the many years I've practiced, I've sent cases to endodontists, and then I kind of check and see what comes back, how they do, and usually, I'm not that impressed with them. A lot of times they just say, pull the tooth,
Hmm.
you know, and so I do the best I can, myself, and but when I sent cases to Dr. Wynn, he'd fix them, and I'd look and I'd be impressed because they were hard. They were terrible cases that no one would want, and so that's good dentistry, and it's a good service to the patients. It gives the patients more options besides having their teeth removed if they get a little bit tough.
Mm-hmm.
So um, I think there's a lot of, and as far as educators, if the endodontists are not doing that hard of endo, I mean, where do you look for education to do better?
Mm-hmm.
There's not that available. Um, but in the root camps and with Dr. Wynn, I found a lot more education that's available and applicable. I've taken cases to root camp that I couldn't, that were complicated, that were failed cases, tough ones I couldn't fix, and we fixed them here.
Mm-hmm.
So
Well, the tooth savers, right?
yeah, it's great dentistry, and so I invite anyone who wants to learn to do better with endo to come here.
Yeah, and now let's talk about what you did this weekend. So you only saw patients this time. You didn't even do it on the cadaver specimen, and
No,
you did one conventional, so one non-surgical, and all of the rest was surgical, right? Am I correct?
yeah, actually, I did yeah, two
Oh, two
non-surgicals
non-surgical.
and then two surgical ones.
I see.
I got to learn the microscope better because Dr. Wynn made me sit a certain way and position it a certain way and told me I had to do it. And so being taught and having to do it that way, all of a sudden you start to learn how to do it.
Mm-hmm.
And so that helped me on my, because my first conventional endo was a calcified canal with a crown on it, and it was a long way down it to even get to the canal, and I was able to do it by using the microscope.
Mm-hmm.
And I drilled, down through the crown, way down, and I saw a little point with the microscope, and I was able to get a 10 file on that under the microscope and go back and forth with it and got it in and solved the case. So microscope for conventional endo. I also learned the root ZX.
Mm.
I learned the proper way of doing that, and so I'm getting better fills. I don't over instrument and have cement come out and all that, and it's quicker. So I learned that, and then also the microscope use in the surgical cases. I did a number 3 mesiobuccal and distal buccal root amputation and fill, apicoectomy and retrofill, and they had really complex anatomy. They had the mesiobuccal root had three canals, and there was no chance that tooth would have ever made it without surgery.
Mm-hmm.
It had a huge lucency that just filled the whole jaw. It was huge. It was full of granulation tissue. That tooth was doomed from day one,
Mm-hmm.
and we fixed it. And then I had another retreat case, a number 5, where the lingual root had disintegrated, and I had tried to retreat it in the past, and it just kind of went out the side of the root and was unfixable, and we were able to do apicoectomies and fills on that, and we fixed that as well. And it's use of the microscope, you can actually see and do those things that are undoable any other way.
Mm-hmm.
Yeah.
Yeah. I mean, seeing is believing, and
Yeah.
it's hard to work in there if you can't see. Now, which do you enjoy the most, surgical or non-surgical?
I like both. But I've done a lot of non-surgical endo, and I've seen some of them are just compromised, or they're just hard to do, maybe not totally successful, and so it's nice to be able to learn solutions to those, because I've seen a number of those throughout my career, and it's nice to learn how to go in and actually fix those right.
Mm-hmm. Yeah.
So it's really important to be able to help the patients get a good result.
Oh, sure. So are you convinced that mastering apical surgery will actually be a great service you'd be giving to patients?
Yeah, from what I'm seeing, that it helps the body heal even better than conventional endo, because you can remove all the diseased tissue and you can get a good seal,
Mm-hmm.
and the things heal super fast.
That's right. That's right.
Yeah, which is awesome. Yeah.
Wow, I'm so impressed that after such career, you're still full of wanting more, and you're still hungry. So we have a promising year ahead of us. As we discussed, you're going to come back for more root camp too, as part of the mini residency program. So
Yeah, I look forward to, the skills. The skills are, you need to be taught. You need to be taught.
That's right.
And you need a little experience and need to be taught, and then all of a sudden you start to learn.
That's right.
So the skills, there's some continued guidance needed for sure.
I would call this the lost art of apical surgery, right? I mean,
Yeah.
it's going away, unfortunately. So
Yeah.
we're going to be the last stronghold of saving teeth. How's that?
I think my patients will like that better.
All right, thanks, John. Thanks. I love walking this path with you, simply because you're motivated, and as you know, I don't like to motivate and feed people. I'm here to help the motivated ones to grow. So looking forward to more coming ahead of us.
I appreciate the
All right.
opportunity.
Give me a fist right here. Ta-da! All right, have a good night, John.
All right, thank you.